Thank you, Ellie, for the kind introduction, and thank you everyone for coming and for the invitation. Carmelina did a wonderful job. So I will be talking a little bit about the neuropathology and brain banking for dementia research. And as a lot of you may know, the definitive diagnosis of Alzheimer's disease is only made at the time of autopsy. The dementia is a clinical syndrome. It's a kind of presentation, this constellation of symptoms that you may experience. Alzheimer's disease is a disease that has a biological basis. Even though we don't know what is the exact cause of Alzheimer's disease, we do know quite a lot about the neuropathology or the changes of the brain that contribute to Alzheimer's disease. In a smaller fraction of people with dementia, the cause is not Alzheimer's disease, but other type of diseases, for instance, like frontotemporal lobar degeneration. And so it is our role as neuropathologists to give a final definitive diagnosis for the patient's family. And sometimes there are genetic predispositions for various kinds of dementia. And it is also important for the families to know whether this could be a possibility. So I am the neuropathology core lead of the Duke UNC Alzheimer's Disease Research Center. And so what does the neuropathology core do? So first of all, we participate in brain donation autopsies. And these are people who have signed up during their life to participate in our studies. So they come to our clinics yearly to do a neurocognitive evaluation. They will draw blood and run some blood tests. And then at the time of their death, they sign up and consent for a brain donation autopsy. And so we do dissect the tissue for diagnosis, but also for biobanking, which I will talk a little bit more about later. We provide a neuropathological diagnosis for the patient and their families. We bank the collected tissue, and that includes long-term storage of the brain tissue, the cerebral spinal fluid, and in some cases, DNA, if the participant consents. We maintain a database with the clinical and neuropathology data, which we can then distribute to investigators worldwide. And that's one other important mission of the neuropathology core. Basically, we evaluate and complete tissue requests that we receive from scientists worldwide, and then we distribute the tissue based on the scientific merit and the tissue availability. And we also provide consultation for scientists who want to use our resources. So the most important part of the coordination for brain donation autopsy really is the family, who oftentimes are so dedicated for fulfilling their decedent's wishes for brain donation, even at times of grief and stress. They call our clinical coordinators to tell us that there is a person, a participant of our study that has passed away. And then it's really the clinical coordinator that has to keep in constant communication with the family, with the hospital, with the body transport team, and with us. We are the final node in this process, the brain bank, where we collect the brains, we fix the tissue, and process them for banking and for diagnosis and further research. So for the rest of my talk, I will show you some pictures and give you an idea of what we do and some basic concepts about the brain changes that happen in Alzheimer's disease and other dementias. So when we after we perform an autopsy, this is a picture of the human brain. So on the left side, this is a fresh brain when it's taken out after the brain donation. On the right side is a brain that is fixed in formalin. So the reason that we fixed is because The brain is a very soft and friable organ, so when it's in the fresh state, it's very hard to cut. It's very hard to get at the anatomical structures consistently to make a good diagnosis. So we have to fix the brain in formalin, which hardens the brain and preserves the tissue and the proteins that we're interested in. So we preserve it for 2 weeks, and then I will be the one doing the brain cutting. So first of all, I do a gross examination or external examination of the brain. So one of the hallmarks of Alzheimer's disease is what we call atrophy, so loss of volume of the brain. So on the left is a typical Alzheimer's disease brain. So you can see that the brain has lost volume. The gyri, which is the folding of the brains, appears smaller, and the spaces in between them become bigger. There are some other syndromes called the frontotemporal dementias that affect the frontal lobe and the temporal lobe more than the back of the brain. And there are some other diseases, such as cortical basal degeneration, that affect one side of the brain more than the others. So then I will section the brain in a very standard way. I look for areas that have particular loss of volume or have change in colors, and that could give me a hint of what is the diagnosis. So there are some other rare diseases that can cause dementia or other movement disorders like progressive supranuclear palsy or like multiple systems atrophy that have a very different pattern of atrophy or brain-related changes. After I do the external examination, I will take standard sections. So what I do is I cut like specific regions of the brain. I put it in these plastic cassettes, which then will be put into a kind of wax called paraffin. So we embed it in paraffin, and that allows our technicians to cut very thin sections, and then I'll be able to stain it with different types of techniques like hemotoxin and eosin, or like luxofast blue, which will label the different brain structures differently. That will allow me to examine the brains under the microscope. So the reason that we have to be very methodical and very meticulous about taking the sections is that all of these different Alzheimer's disease and other neurodegenerative conditions are caused by abnormal aggregates of proteins. So it could be plaques that's caused by amyloid beta, tangles caused by tau, or Lewy bodies